Now that we have worked on building trust and rapport with the horses in the previous weeks, and we have learned new coping skills to utilize for the PTSD symptoms, we're going to progress in our skills and focus on groundwork with the horses. So the goal of this activity is to continue to work on trust, but taking it to a whole different level using increased communication with further body awareness and proprioception, but also implementing dual tasking. These are skills that will continue to promote our overall goal, which is the ability to engage in ADL routines and meaningful social interactions. The activity that we will be completed will begin with the participant leading the horse around in the arena through an obstacle course. So the person will utilize decision making to decide which way they are going to complete the course, while maintaining that body awareness and safety to safely lead the horse through each segment of the obstacle course. They will have to utilize communication that they provide to the horse, both verbally and non-verbally. So what the obstacle course will look like, it will have items that they can walk the horse around, items that they can step over with the horse of potential various heights, and then different stations to stop at to complete tasks of their choice, such as beanbag toss, ring toss, basketball, different forms of puzzles, or even setting up stations to stop and just practice the coping skills that they've previously learned. So another challenge that can be added, depending on where the person is at that day, would be allowing the participant to set up the obstacle course prior to completing all of this. And so this employs their creativity skills and planning skills when they are the ones setting up the obstacles and dreaming up the order in which the activities will be completed, or which steps they're going to take first, as nobody has to complete it in the same order. It also provides a sense of control for them to set up the activities they feel comfortable with, or even create a challenge for themselves if they choose to include an obstacle that seems uncomfortable or difficult for them to complete that day. Depending on their comfort level and progression with this task, the individual can then complete the activity while now on horseback, so taking it up to riding the horse through the obstacle course, of course with having the therapist leading the horse for them. They will again utilize communication by having to tell the therapist verbally and out loud how they are going to complete the course. So again, which steps they are going to take first, which activities they will be completing. So this will include telling them where to stop, which way to navigate, what they're going to do next. So being on the horseback provides a different sensory input with different proprioceptive input and a level of being present to remain safe and on top of the horse. Although there is a higher challenge to completing the obstacle course while on the horse, there is still a sense of security by having the therapist lead the horse for them, although they are still in control of the direction that they go. It is still preferred that the rider is the one making the decisions and guiding the therapist to promote that dual tasking and decision making, much like is going to be needed during their completion of meaningful occupations and ADLs or social interaction.